We had a network public health program in Ukraine in our early days, and we had the opportunity to visit hospitals and to begin to work with the palliative care clinicians there. And we heavily developed a very clear curriculum for educating healthcare professionals. So there was a rapid buildup of the educational knowledge of clinicians, and we had multiple people that played a role in developing that. And then at the same time, there was the greatest inequity that we identified, among others, was this lack of available oral morphine. And the government had a policy that was that 50 milligrams of IM morphine was the amount of medicine that you could give to a person on a daily basis, and it had to be given by injection. And so with a range of different people, but with our communications people at OSF, we developed, and part of another project, the campaign on torture and healthcare, which was again a network public health program that was developed. We filmed a young man by the name of Vlad, and Vlad was, this very appealing young fellow who had a primary neuroectodermal tumor, and he was given injections of parenteral morphine by his mother, but the limit was all that he could have per day was 50 milligrams. And he became tolerant to the medication and needed higher doses. And his mother pleaded with the physicians, but that wasn't possible. And over time, and for him to receive an injection of morphine, his mother was not allowed to give it to him, but the nurses from the daily routine local nursing service had to come to inject him. So injectable morphine works to 4 to 6 hours, and there was no way that these nurses were coming every 4 to 6 hours. So he had social supports, he had family support, he had community support, he had all of that. He just didn't have pain relief. And this was the torture piece of it that we identified and called it as such. And so there was a video made that was on YouTube and was again shown on the national media in Ukraine. And it was quite embarrassing to the Ukrainian government. And so it wasn't that there were large numbers of people against doing something different. People didn't know what to do, and they didn't know what would work differently. And they didn't know that oral morphine could be substituted. And they didn't know that they could escalate these oral doses of drugs. And so it was an incredible sort of lack of knowledge, coupled with a concern that this was morphine and a controlled substance. We needed another way to be able to convince both the public as well as the policymakers that this was just not kindness and compassion and care, that this was much more than that. This was that these people had a right. They had a right to health, and then within that right to health, they had a right to access medicines for their symptom control. They had an access to provide care for them when they were dying at home, and that they had a right to a quality of living. And so that, I think, began to then resonate with the palliative care community in ways that was very powerful. And they readily took it up because it was, these are individuals that this is what they care about, is quality of life and the right to health. And so this was something that they could easily assimilate. Although, be assured, there were many of my colleagues who thought that I was just going off the cliff by calling this torture, and that I was being overly dramatic, and that this was just not the way we talked about this, and this did not resonate with them. And yet, again, slowly, as they began to realize the dimensions of torture and understand the torture conventions, they began to see that this could potentially be conceived of as torture. But I think there was a pushback on the torture piece for a period of time until it became accepted. And now I think it's pretty widely accepted. There are always many surprises. And so I think it's how fragile the systems are. And I knew that, but I don't think I knew how fragile they were. And so when a government changed, all the work you've done for the last 6 years got sort of wiped away, because the officer you were dealing with, the minister of health you were dealing with, the legislature you were dealing with was no longer in power. And you had to start over. And so I think that's quite discouraging, and enough to say, why am I wasting my time on this? But at the same time, that was how it was. And so I think that once we understood that, even though we knew it would happen theoretically, when it actually happened, I think it taught us how we were going to move around this. And that's why it was so critically important to have the local medical champion and the foundation champion, because the government that we were relying on was going to be changeable. And so the two things that were not changeable for the most part were the National Foundation and our local champion. So the champions in two places were still there. We just lost the government. So at least we didn't lose everything. And those two could support each other in the idea that this had happened and figure out ways or strategies around it or start to rebuild. But at least they had a history. They had a narrative. They knew how to have gotten to that point, and they could keep that history. If you didn't have that, if you didn't have that National Foundation individual, if you didn't have that champion, and we had heavily relied on, one of the three, like the government, it would have never, it would have died with the program kind of issue. So I think, to me, the frustrating, most challenging aspects is that there were so many things beyond our control, okay, to influence the kind of work that we were trying to do. Because this required policy changes. This required, policy changes related to morphine. It required policy changes related to who could deliver nursing care. It required policy changes about who could deliver home care. It was about who could be paid for home care. I mean, we were in the weeds on these issues. And you'd ask, why were you in the weeds? Because being in the weeds was how it happened in a medical delivery system.